Pericardiocentesis is a procedure that removes fluid from the pericardial sac. So remember, the heart is enclosed in a double membrane sac. The outer layer is the parietal pericardium, and the inner layer is the visceral pericardium or epicardium. Between those two layers is the pericardial space, and sometimes there are different reasons why abnormal amounts of fluid accumulate here. And so when that happens, then the patient needs to have a procedure called the pericardiocentesis. Inflammation of the pericardium is called pericarditis, and there's various reasons why that would happen. And pericardial effusion, again, is an abnormal accumulation of fluid in the pericardial sac, in the pericardial cavity. Cardiac tamponade, that is the term for pressure being placed on the heart because of pericardial effusion. Okay, so all of this fluid around the heart puts pressure on the heart, and so it causes the ventricles to not fill correctly. So then therefore as much blood isn't being pumped out, and so it's kind of a domino effect, and that's what pericardial effusion is. So this is a picture just kind of demonstrating the pericardiocentesis procedure, and basically it's as simple as this. Put some local anesthetic here at the xiphoid tip of the sternum, stick a big needle in it, and pull back and aspirate, and that's pretty much it. Here's a video that demonstrates the procedure. Okay, now one thing I want to point out here is that this is done in the cardiac cath lab most often, but just because it's done in the cardiac cath lab doesn't mean that we use x-ray. There are some procedures done in the cath lab that, the x-ray machine isn't used, and so a lot of times this is done under ultrasound guidance. And so this could be done at the bedside, if the ultrasound machine were taken to the bed. But a lot of times it's just done in the cath lab just because that's what's familiar. That we've got the table, we've already got the sterile drapes that you need, the chloroprep, all of the prep, and also then the scrub assistant is already there. I mean, everything's just all set up already. So a lot of times they're done in the cath lab, but do understand that this is done with ultrasound guidance. So anyway, it's showing the needle just going in. Of course, the skin has been cleaned and prepped here. The needle's going in, and then once the needle is in place, they put a syringe on it and start pulling back. This is kind of neat because this is like an internal view. So this is the heart, and it's getting ready to see that there's just puncturing the thorax, but then this is below, that's the heart. Okay, so here that's where they're pulling back or aspirating, and so now they are removing that fluid that's built up in the sac there. And that is a pericardiocentesis.